I'm truly honored to have been chosen for this recognition. The other finalists are so incredible. I'm still trying to comprehend how I'm the one standing here. In my mind, each finalist is equally deserving of this award. They each inspire me to be a better person. I thank the Schwartz Center not only for this award, but also for their 20 years of promoting compassion as the very heart of healthcare. I think the Schwartz Center is successful mainly because its mission connects with what's in all of us. We all want to help those who suffer, and we all need to help those who need to feel the healing power of love. Compassion can make a profound difference for patients. I have experienced this myself as a patient, and I bore witness to it when my mother was a patient battling cancer. She was not one to lose a fight, but sadly she lost this one. It was the compassion people showed her that still stands out to me. Like the nurse who took time to practice the words she remembered from his visit to Japan, her birth country. This pleased her to no end because she loved to correct people. In fact, I heard her voice in my head even this morning scolding me for not bringing a warmer coat to Boston. Compassion was also evident in the doctor who treated my father after his heart attack. I'll never forget the pain on his face when he told me and my mother that the resuscitation was not going well. When I asked him to stop, he actually shed tears with us. There were many involved in their care, and I remain incredibly grateful for what they did. So when patients tell me, "You were there for us, you were like one of the family," we appreciate what you do. I know that what you do part is not that I remembered every drug on their medication list or thought of yet another procedure or a blood test. The what you do part is that we care and they can feel it. Recently, I went to a funeral of a patient. Doctors struggle with attending funerals because there is a worry that they'd just be forcing the family to relive painful moments. And so I tried to melt into the background, but was motioned toward the front by the family up to the graveside. I didn't want this to be about me in any way, so I just acknowledged the mother and father, and I then tried to kind of back out. But after a few final remarks, the funeral director actually walked up and he said very loudly, "I just want to thank Dr. Boyte for being here. In the 2 decades I've been doing this, I've never seen a doctor come to a funeral." I was humbled by that and realized then it was definitely the right thing to do. But I was also a little sad that he could make a statement like that no doctor had shown up in all those years. Our presence is not enough, of course, but it is important. People want to know that you have the time for them. The first step in developing a good bedside manner is to show up. I try to take my time and not appear rushed at all. I want them to know that for those moments we're together, they are my total focus, and I care about them. I remember an encounter from my intensive care career. I had finished my fellowship, was very eager to start practice. I had come back home to Mississippi and was one of just a few people in the PICU. So there was a lot of stress, a lot of pressure on me to do my very best to really deliver for patients. And we had admitted a baby who had meningitis. Unfortunately, over the course of 48 hours, the baby's condition worsened badly. And despite everything we did, that continued. The parents approached us, asking whether, with her suffering, we should continue to do so much. After several conversations, we decided to withdraw support. And so we did one night. I wanted to be of help, to help those parents do that. They were a sweet couple, now facing one of life's cruelest losses. I tried to remain as much as possible in what I considered a professional demeanor, to show I cared but not break down emotionally. But inside, I felt like a failure to the family and a failure to the baby. I waited until I left the room to shed any tears. But standing outside, I put my head against the door and I just cried and certainly felt awful. After a moment, I turned around and I realized there was someone there. It was the baby's grandmother. I said, I'm sorry, because I thought I was blocking her way into the room. And she said, I want to thank you. And I said, no, please don't thank me. I didn't do anything. And she said, no, not for what you did these last few days. I want to thank you for your tears. It's been over 20 years since that happened, but it stays with me. It's a lesson I share with my medical students and residents. We're human, and it's all right to show that. At our hospital, we are building a medical home for children with complex and fragile conditions. This takes a team of professionals that are in many ways like my second family. Like my family, we may not always agree, but we're all drawn closer to each other by our work, by our common purpose. In palliative care, we can't cure often, but we can always improve on a situation. And compassion is a big part of that. That's what helps patients get through the day and helps us as well. So I'm sure you understand why I share the honor of this award with my colleagues back home. I can never thank them enough. And I also share it with those who most inspire me in my work, my patients and their families. They are indeed my heroes. They are the most courageous people I've ever met. The love and devotion I've seen from families is truly amazing. And the children are awe-inspiring. Despite whatever they're going through, they're still kids. And that means, despite the pain and the hardship, they will still play, they will still laugh, they just want to be kids. Who also sustains me, and I'm so very proud that she's here tonight, is my incredible wife, Lisa, whose many sacrifices has allowed this moment for me. Thank you. I also want to thank my children, Matthew, Landon, Megan, and Mary Caitlin. The love of family keeps me going, and I am so happy when we're all together. So when they see this, they'll know this is a hint that I want them all home for Christmas. I also thank my parents. They had to sacrifice a lot to get my brother and me through college, and then me through med school. Throughout my childhood, becoming a doctor was, in truth, more my mother's dream than it was mine. In fact, by the end of the second year of med school, I was struggling, and I had to come home and tell her something I really didn't want to. I said, Mom, I think I'm going to have to quit. I'm actually incredibly miserable. And she gave me a great gift with her answer. She said, if this is really making you miserable, Ricky, then maybe you should quit. That would be okay with me. And it's because she gave me that gift of compassion and permission to be compassionate to myself that I was able to actually stay with it. And then the third and fourth year of med school is when I got to interact with patients, and I saw the impact doctors can have on the lives of other people. That is what kept me going. That is what brought me to this point, to be here with you and to say thank you. Thank you all very much.